All right, good evening, everyone. This is Kyle Boudreau. I'm with Medtronic. I'm welcoming everyone that's joined us this evening for a talk on overactive bladder hosted by Dr. William Bradley Roth. Dr. Roth has been in practice in Lafayette for over 15 years now. He brings a great wealth of knowledge on this specific topic and has a real passion for helping people, helping his patients, and helping educate patients throughout the Southwest Louisiana area. Dr. Roth primarily focuses in urology and has a very fine interest in men and women's health when it comes to overactive bladder disease. And tonight he's going to share with you educational points about the disease state, treatment options, and some follow-up options. So on the screen with me is Dr. Roth and his nurse navigator, Danielle. So these are some faces that you might become familiar with in the future. And so I just wanted to have them on here. So Roth takes the ball and runs with it. Without any further ado, I'd like to turn the ball over to Dr. Roth, and he's going to get the program started for everyone. So thank you all for joining us.
Okay, thank you all for being here tonight. I don't know if some of you are repeat patients or repeating. Maybe you've heard this talk before, but we're going to talk tonight about incontinence. We're going to focus more on frequency and urge incontinence, and we'll describe the different types of incontinence. But if y'all have any questions about incontinence in general, I'll be happy to answer them at the end. There is a chat bar down here that you can type your questions in as well. Let's see. Let me start this. Okay.
I don't know if you're screen sharing. Did you hit screen share?
No, I didn't. Okay, guys. Hold on one minute. All right. So I am not going to cover all these slides verbatim because that makes for a very boring talk, but it just kind of lets you know what we're going to talk about, and it keeps me on track, but I won't follow these verbatim. So welcome. I'm in Lafayette now. I grew up in Baton Rouge, went to LSU Medical School in New Orleans. I did all my urologic training at the University of Texas in Galveston. And I'm back here. I'm on my 19th year. And that's a little bit about me. Love incontinence. So what's important to understand about incontinence is it's a very common problem. Unfortunately, many people don't speak to their physicians for various reasons, embarrassment. Some people feel like it's a natural part of aging, which it's not. And so 50% of people never even discuss it. And so if you don't discuss it, it certainly can't be treated. But, you know, things come up in people's minds. Will I ever gain control? How can I possibly go on a date, go to an outdoor celebration? What am I going to do at my job? I can't get up and go as frequently as I need to. People generally tend to stay around the house when they have a lot of frequency, urgency, and incontinence. And certainly anywhere you go, you're always thinking about the bathroom, and this starts to affect the quality of your life. Our agenda tonight is to discuss how the bladder and bowel functions, a care pathway for the treatment, and we'll talk specifically about the interstim and neurosystems for frequency and urge incontinence for the bladder and the bowel, and also answer any questions you may have. So when we look at urinary incontinence, it's a very common problem. 1 in 6 adults have overactive bladder. That's just urinary frequency and urgency, and also urge incontinence. It's all in the same OAB spectrum. A little less common, but still more frequent than you would think, would be fecal incontinence. 1 in 12 adults. People tend to talk less about with their doctor about fecal incontinence because people really think I'm the only one that has this. How embarrassing is this? So this even gets less attention than urinary incontinence. Basically, when we talk about what's normal in terms of urinary and bowel habits and aging, basically, as we age, as we get more pathology with the bladder, we start to have more frequency. And if you're having incontinence, frequent accidents, and when you have to go to the bathroom, you have to go now with a sense of urgency. You start planning activities around the bathroom, and I hear this every day. People, can't drive from New Iberia to Lafayette without stopping twice. They know where the bathrooms are, where the gas stations are, and restaurants. People start to do their own behavioral modification by monitoring and reducing their fluid intake. And, once it gets bad enough, you start using pads and protective garments just so you don't have the embarrassment of wet clothes. We're going to take a very simplistic view of how the bladder and the bowel function. You have the neurological system, brain and spinal cord, which has nerves. As the bladder fills, you have a certain nerve pathway that communicates with the brain to let your body know that the bladder is full. You have a second set of nerves that go to the bladder to tell the bladder to contract. And so the bladder does 2 things. It stores urine, and it contracts when it's full so that you can urinate. And when all that happens, you do it at a time of your choosing, when it's socially acceptable and not otherwise. And when there's a breakdown in that process, that's when you have incontinence. You're going to the bathroom, without your or the bladder is leaking without your consent, and that may be a deal between the bladder and the brain, but you had no part in that, and that's when we have incontinence and embarrassing moments. The bowel is basically the same way. You have nerves that basically tell you that the rectum is full. Same nerve pathway stimulates the rectum to contract, again, so that you can have a bowel movement when it's socially acceptable, and only when you are ready to have a bowel movement. So that very, very simple terms. That's what should happen in normal circumstances. When that system is messed up, that's when we have urine and bowel accidents. So incontinence, what causes it? I mean, there are different reasons why people have incontinence, both urinary and fecal. Certainly our daily habits, what you eat and drink, can affect that. The most common things are, for instance, coffee, iced tea, lots of water. We all know if you drink 3 or 4 cups of coffee, you're gonna have to go to the bathroom very frequently in the morning. Alcoholic beverages also contribute to frequency of, especially the urinary system. Certain medications and supplements you take can affect this. The more common medications are the fluid pills that you take, which are designed to rid your body of excess fluid, and that happens through the urinary system. So if you have any trouble with incontinence, frequency, urgency, and your doctor puts you on a fluid pill, that's just going to exacerbate it. If you have reduced physical mobility, the most common scenario would be, for instance, when someone has a stroke and they are either wheelchair bound or they're having to use a walker or a cane, and you get the urge to go. If you can't get to the bathroom as quickly as you used to be able to, where before it wasn't a problem. Now we've created a problem where you have incontinence because you can't physically get there. Pregnancy and childbirth are common causes of stress incontinence. We're not going to focus on that tonight, but that is a more common cause of stress incontinence. Pelvic radiation causes fibrosis in the bladder, which makes it not want to fill as much. So instead of filling under very low pressures, it gets to a point where it's completely full and it contracts without your consent, and you have incontinence. Any pelvic floor injuries can also cause incontinence. The three different bladder control problems can be categorized in the stress incontinence group, urinary retention, and overactive bladder. Stress incontinence is when people leak when they cough, laugh, sneeze, bend over to pick up something or tie a shoe, bend over to pick up a grandchild, exercising, anything that uses gravity to help the ureter pound on the bladder neck. If you've got insufficient pelvic floor muscles and basically what happens a lot of times is bladder descent, and that causes the sphincter muscle to not act, to not work properly. The urine will leak. That's called stress incontinence. Urinary retention is when you either cannot urinate at all or not completely empty your bladder. And the bladder is a tank, so it's designed to fill to its capacity. And when you urinate, it's designed to completely empty. And when that happens normally with normal sphincter control, you don't have any incontinence. So if you have retention, and again, whether it's you not being able to urinate at all or not being able to empty, your bladder fills, you have an urgency to go. If it contracts and it stops half full in a very short period of time, as it fills, you have urgency and frequency again. So you're stuck in this cycle between half full, full, half full, full. So you're constantly feeling the urge to urinate. And so what my job is when I'm seeing someone is to figure out if someone's got frequency and urgency. My first step is the bladder emptying or is it not? That's always the first step because it's treated very differently. Overactive bladder simply is the symptom complex of urinary frequency, urinary urgency, with or without incontinence. So that's all grouped into the overactive bladder. This is when you're holding yourself. You'll see kids with OAB, they're dancing around because they need to go and they're looking for a bathroom. I guess adults do that as well. But basically, urgent incontinence is you have urgency and you wet your pants before you get to the bathroom. And that can be a problem in general, but especially if you've had mobility issues, again, after a stroke, or if you've got a broken bone or broken pelvis, it becomes an issue. This results in frequent leaks, constantly looking for the bathroom, and feeling like your bladder is never empty. Now, some people come in and they say, well, I know my bladder's not empty because I constantly feel like I need to go. It could be urinary retention where you're not emptying all the way, or it could just be overactive bladder where the bladder is emptying all the way. It's just that it may not be filling completely, so you're constantly feeling the urge to go. So failure to empty is a problem. Failure to store is a problem. So that's my job to figure that out. It's all treated differently. Fecal incontinence is basically the same as urinary incontinence. You get maybe an urge to have a bowel movement and you're not getting to the bathroom in time. And most of us, if we had to pick one, we'd probably rather have urinary incontinence because that's a little easier to deal with than fecal incontinence. But it's the same, either failure to store or failure to empty. The good news is we have treatment options, of course. That's why we're all here tonight. There are many ways to treat overactive bladder and fecal incontinence and get back to living a good quality of life. We always start very conservatively in the office when we're talking to people that have urinary and fecal incontinence. We normally start with dietary changes. Obviously, we talked about coffee, alcohol, iced tea. Like, the more you drink, the more you urinate. There are certain foods, for instance, if we're talking about fecal incontinence, fatty foods are going to stimulate the bowel to contract. So if you're having trouble already, then you may want to avoid fatty foods. That's specific to the colon. Exercise and physical therapy can certainly help stress incontinence, strengthening the pelvic floor. Physical therapy can also be helpful in preventing urge incontinence as well. And we have a physical therapist that we use that does a lot of pelvic floor muscle teaching, which can be helpful for not only stress incontinence, but also urge incontinence. So these are very simple ways without medications, without surgery. And sometimes when I see people, they're past that point, they're ready to be fixed. And other people are just getting into seeing about it, and they're up for doing conservative things. I'll meet you wherever you are. Oral medications, there's lots of oral medications out there, especially for urinary urge incontinence. These overactive bladder medications have lots of side effects: dry mouth, blurry vision, constipation, high blood pressure. Many times people stop taking their medications, and this different surveys, up to 75% of people stopped taking it even though it was working due to the side effects. We have more advanced therapies. We're going to talk about a couple of these therapies, the InterStim therapy and the neurosystem. And there's also injectable medications. This is for bladder. For the bowel, we have the Medtronic InterStim system. There's also surgical options. Bladder Botox, most of you are familiar with bladder or Botox. Botox has been around for years in the cosmetic world, and still very much alive and active today. But Botox is used in many different arenas, and we have one in urology for overactive bladder. This has been out for quite some time. This is to treat urinary frequency, urgency, and urge incontinence. The medicine's injected into multiple areas of the bladder muscle. We do that in the office here. Can be very effective. The upside is that it's quick and it's easy. The downside is that if it works good, you have to do it twice a year for the rest of your life. So, some people just get tired of doing that, and they start looking for other options. It's not 100% effective, but it is fairly effective. It does not treat fecal incontinence, and it can create the need for a person to self-catheterize if the bladder fails to empty, and it is possible with Botox, so we have to be careful. If y'all have any questions, please type them in the chat room, and we will answer them. I want to talk about two systems that Medtronic has. They are sponsoring this program. We're going to talk about the neurosystem first. This system involves, this is done in the office, placing a very small needle next to your posterior tibial nerve, which comes down here. What happens with this is that this needle is hooked up to a small generator. It sends electrical impulses, which go via the tibial nerve all the way back to the brain. I mentioned in that slide earlier, there's a pathway for the sensation that lets your bladder know it's full, and there's a pathway to tell your bladder to contract. What the neurosystem does, it sends impulses through the pathway that tells the bladder tells the brain that the bladder is full. What it does this is just a very easy way to think about it. And this is how I explain it to patients. They're little electrical signals that bombard the brain with incoming data about the bladder. And the brain, I think about it like this, it gets so overwhelmed, it forgets the signals to contract. And that's what happens with urinary urgencies. The brain is sending the signals via the muscle pathway to tell it to contract. And so with the neurosystem, by sending all these little electrical impulses to the brain, it in a way just relaxes it to it because it's overwhelmed. This is delivered in the office, 30-minute sessions for 12 weeks. This is followed by monthly maintenance sessions for long-term relief. The other system that Medtronic has for urinary frequency urgency and urgent incontinence is the interstem system. The interstem system, the next slide is, basically works like the neurosystem, except it sends little electrical impulses, but we're doing it more at a central level. Your spinal cord ends at between the first and second lumbar vertebral bodies way up here. Your vertebral column continues down here to the sacrum bone, which is the tailbone way down here. We can put a small wire in the office. We inject a little lidocaine in the skin in your back. This is very easy to do. We put a small wire under your skin. We send little electrical impulses with a generator. Instead of to the posterior tibial nerve, we go to the third spinal nerve, right by your tailbone here. And it does the same thing, but it's closer to the brain, sends those signals, which bombards the brain, it kind of overstimulates it, so it just has a very relaxing effect on the bladder. It breaks that cycle of signals coming from the bladder and signals going from the brain to the bladder to make the bladder contract. It breaks that cycle with all this stimulation. It doesn't hurt. It's a very, very soft sensation, fluttering that a person can feel. So the difference between the two is this is more of a central location. The neuro system is done in the office, 30-minute sessions over 12 weeks. This is one test that we do. We send you home with the wire, and you keep avoiding diarrhea at home, usually for a couple of days. And you come back, and if it works, then we put a permanent wire in position and a small little stimulator that goes underneath the skin in your upper buttocks. And you're done. You don't have to do this over 12 weeks. You don't have to do it every month for long-term improvement. You do this one time and for the life of the battery. And as long as the battery's working, the system's working. If the battery dies, we come back, make a small incision, take the battery out, change it. It's very easy. The test is easy. The permanent implant is easy. And I love this procedure because sometimes this is the only thing that really helps people. And unfortunately, a lot of people are not aware of this. Many doctors, certainly outside of urology, are not familiar with it, so you don't hear about it. You don't really see a lot about it on television. And even if you're seeing a urologist, they may not do it, so they may not mention it, and they're not even very comfortable talking about it because they don't do it. But it's very easy to do, and we do the test in the office. So it's definitely it's in my algorithm. So the first first way to get better is to say yes to the test. We do the test in the office. We can do this in 10 to 15 minutes. As I said, thin wire is inserted in under the skin. You go home with a little external stimulator hooked up to that wire. You start your voiding diary, and you can have immediate improvement in your urinary symptoms and bowel symptoms. So this system is helpful for urinary incontinence and fecal incontinence, whereas the office-based neurosystem is only for the bladder. It is very effective. 89% of people using the Medtronic system have prolonged success and significant quality of life improvements. So you're a good candidate for the Medtronic system if you have any of the frequencies of urinary frequency, urinary urgency, urinary incontinence or fecal incontinence, or urinary retention. And, you know, this is one of the things when your bladder is not emptying either all the way or not emptying at all. This is one of the few the few treatments we have that can actually help you, as opposed to, you know, urinary catheterization, which no one wants. So if you've tried lifestyle changes and you've tried oral medications, you don't have to try all of them, but we usually try, you know, at least one in that class. And you're not better and you're not happy where you are and your quality of life is suffering, you're definitely a candidate for the Medtronic system. And get back to doing the things you love. I'm going to talk about some of the frequently asked questions. And again, if you have questions, please use the chat icon at the bottom and we will get to those. How long does the relief last? This can be effective out to 5 years, because at 5 years, you know, that's pretty much the life of the battery. And so we have to change it. Will it cure my condition? It treats the condition. It's not a cure. It's just controlling your symptoms. What does the stimulation feel like? It's basically a flutter. It's not painful. It shouldn't be painful. If you turn it up, if it's painful, it's usually turned up too high. So we always tell people that you know, it doesn't necessarily work the higher you go in the stimulation. We just want the stimulation to where you can feel it and it's very comfortable. Insurance does cover the Medtronic system. Yes, you can have an MRI. The newer systems are all MRI compatible. What are the risks? Anytime we put foreign material in the body, infection is always a risk. I live in the implant world, not only with the Medtronic system, with other implants. And so I do a lot of implants. And yes, we occasionally have infections, but they're very low percentages. Infection, damage to any of the structures we're around. I've never had a problem with the Medtronic system. I think maybe I've had one infection I've had to deal with, but this is a very easy, low risk, low complications procedure. Any questions? If y'all have questions about even stress incontinence.
I would just comment on that page you had a minute ago is a phone number. If you could click back maybe 2 slides. There's a phone number there at the bottom. If you'd like to follow up with Dr. Roth, you can call that phone number. That will go directly to Danielle, his nurse navigator, who can help to set up an appointment or a consult with you. Or if you'd like to visit his website there in the middle, you can do that to learn more about it. And Dr. Roth, there's a question down in the chat function.
We can't see it.
Okay, it says, how soon can I get Medtronic system?
If you call, we will find a little spot for you to get in and get you going. I would say realistically in the next several weeks, we could get you in.
And we're also recording this event, so we'll plan to provide you with access to the recording following this webinar, and follow up with you within the next 48 hours if you'd like.
Via email.
Okay.
If you want to close it out, I'm in the middle of a rainstorm over here. I don't know if they could hear me.
Yes, we hear you. Yeah, so I can't see who's on, and I don't see any questions, but I certainly want to thank everyone. Okay. I certainly want to thank everyone for attending this. I hope it was helpful. This is just a a quick overview of overactive bladder and some of the treatments. Obviously, if this is affecting your quality of life, you need to call and get in here. We can, there's always something we can do to help. And if it's not the Medtronic system or medications, we have some other tools. And I'm really passionate about this, and never give up on someone with incontinence or overactivity, because there's always something we can do. So appreciate everyone coming on tonight, and feel free to call, and thank you very much.
Thank you, everyone. You have a wonderful evening. Good night.